everyone, and welcome back to another 5 in 5. Yes, in today's video I'll be talking you through some more tools that will help you in your consultations with your patients. As always, if you enjoyed the video, then be sure to give it a thumbs up and subscribe if you haven't already. Let's get straight into the video. So today's video, like I said, is another one about tools that will definitely help you in your consultations with your patients. These tools are evidence-based, objective, and help inform your patients about the best treatment for them, so treatment tailored to their needs. And these tools can definitely help you in short consultation times, such as when you're consulting in general practice. The first tool I'm going to talk about is the Wells score. You may have heard of it. So let's go through a scenario. A patient comes to you with a 5-day history of a unilateral, so one-sided, swollen leg. The leg is also painful and slightly warm to touch. So of course there are a few differentials you should be considering. The obvious one is a DVT or a blood clot in the deep veins in the leg. But how do you estimate the probability or the likelihood that this is going to be a DVT versus something else? So you can use the Wells score. And what is the Wells score? So according to NICE, it is a clinical prediction rule for estimating the probability of a DVT or a PE. There are a number of different versions of the Wells score. NICE have recommended the 2-level DVT and PE Wells score. So as you can see, depending on the patient's symptoms, a score will be calculated. The guidelines do suggest the likelihood of this being a DVT or a PE and the treatment based on the score calculated. So if the score is 2 points or more, then this is a higher chance that the patient could have a DVT. The patient may need an ultrasound of their leg, they may need a blood test, and they may even need to be anticoagulated. The second tool I'm going to talk about is the QRISK score. So this tool or algorithm predicts a person's 10-year CVD or cardiovascular risk. It is important to mention here that this is just an estimate. And like the above, there are different versions available and they are updated. So QRISK 3 is the 2018 version and it is used for patients between the ages of 25 to 84. But importantly, excluding those who have established CVD or who are at a high risk or developing it, or people who are aged 85 and over. Patients with type 1 diabetes or CKD, chronic kidney disease, are automatically considered at high risk, so you do not need to complete a QRISK score. Let's briefly define CVD, cardiovascular disease. So this is an umbrella term that includes a number of conditions that affect not only the heart, but the blood vessels too. It is caused by blood clots or atherosclerosis, which are basically where blood vessels become lined with fatty substances or deposits. So how do you explain this really useful tool to the patients that you're treating? The score calculated will tell you if someone is at high risk of developing cardiovascular disease within the next 10 years. For example, if the patient's score was 15, it means that if there were 100 people, 15 out of those 100 with the same risk factors as the patient, so for example, age, sex, and so on, would be likely to suffer a heart attack or a stroke within the next 10 years. Ideally, the score should be less than 10 or less than 10%, and the patient may want to know how they can reduce their score. So for many people, simple modifications to their diet and lifestyle, in addition to optimizing any current treatment that they're on for existing medical conditions, will help reduce their score and their risk. Now, everyone who has had an assessment should be automatically given diet and lifestyle advice, regardless of their score, and this is according to NICE guidance. Examples will include things like smoking cessation and weight loss support if they are overweight or obese. Really quick note on statins, which are medications that aim to lower cholesterol. Again, according to NICE, a statin, in particular atorvastatin at 20 milligrams, should be offered to the patient if the patient's score is more than 10% and where lifestyle measures have not worked initially. And this is called primary prevention. So preventing something happening in the first instance, like a heart attack or a stroke. Of course, when you start any medication, be sure to have in-depth discussion with the patient about the benefits and risks to starting medication. And of course, you can't prescribe if there are any contraindications. So reasons as to why it can't be prescribed. So that's a basic intro. I hope you found it useful. I hope you have the confidence now to look into those tools a bit more and to even use them with the patients that you see. As always, if you enjoyed the video, then be sure to give it a thumbs up and subscribe if you haven't already. I will see you in the next video.